Faithfully execute
the office of President of the United States.
the office of President of the United States.
Upon his inauguration on January 20, 2025, President Donald Trump signed an initial tranche of executive orders to implement his domestic and foreign policy priorities that send U.S. foreign policy on global health in new directions and that portend more changes as his second term proceeds.
So we paid $500 million to World Health when I was here, and I terminated it. China with 1.4 billion people. We have 350 to pay. Nobody knows what we have because so many people came in illegally.
However, these directives have left many developing countries limping with the impact since the USAID funding had been their major hope. In Uganda, the Trump executive order on global health has left over 3,000 health providers, including doctors, nurses and laboratory attendants, jobless in addition to 1.5 million Ugandans living with HIV facing potential disruptions to their medical supplements and ARVs.
This has stretched the remaining health workforce, compromising the capacity of both the public and the private health services, providing essential care, more so to HIV and TB patients. Additionally, this crisis leaves over 1.5 million Ugandans living with HIV/AIDS and TB facing uncertainty in their future regarding their continued care and access to antiretroviral treatment.
Addressing the media in Kampala, Herbert Luswata, the president of the Uganda Medical Association UMA, demanded that the government create a supplementary budget that would cover salaries for affected health workers and provide resources for HIV and AIDS treatment, care and prevention services including PrEP, condoms and HIV test kits.
The proposed budget should provide for the reinstatement of the salaries for health workers previously funded by USAID projects and allocation of sufficient resources to ensure uninterrupted HIV and TB care, including procurement and distribution of reagents and all the necessary medications.
I also want to add my voice to asking or requesting that the Ministry of Health does come up with emergency solutions to, based on the recent USAID freeze. There are so many young professionals that have been working under that program and who have since lost their jobs, but we saw the PS asking them to volunteer, which becomes a bit very difficult for someone to volunteer in such a case.
Additionally, the association has raised the concerns about the ongoing Ebola outbreak, citing unfair treatment of frontline workers and unpaid wages. This also cautioned fellow medical practitioners to take extra caution by following the guidelines from the Ministry of Health.
We commend the government's swift response and effort to combat the outbreak and contain its spread. However, there has been reports of non-payment of allowances to health workers who provided critical care to Ebola patients during the previous outbreak at Mubende Regional Referral Hospital. These unpaid debts have caused significant dissatisfaction among health workers involved.
To my colleagues in the Federation, the interns in the various sites, that please be careful and observe all the IPCs, all the infection prevention control measures. At least ensure that as you are attending to those patients, you have the basic PPEs like masks and gloves. Where necessary, you should also have aprons.
They also expressed concern for Dr. Kiza Besj, a former presidential candidate and medical doctor who is currently in Nsira prison and reported in poor health. The association has requested that Besj be transferred to Mulago National Hospital for proper treatment.
We have written to the Commissioner of Prisons requesting for a medical report concerning the doctor's health so that we can allay fears among colleagues concerning his medical care, but also requesting his referral to Mulago National Referral Hospital for further assessment.
We are actually in a by-election at this moment because we lost Honorable Segiri Nyamhamad in prison because he was denied access to good health care when he asked for it. So we add our voices to the many, demanding that Dr. Kiza Besj, who is our fellow medical professional, be given access and granted to look for good healthcare services because we see the state he's in and he deserves to be in a much better state.
However, the association denied mobilizing a demonstration against the government over the alleged deteriorating situation of Dr. Kizza Besigye while in Ruzira prison.
We categorically reject these unfounded claims. Uganda Medical Association is not a political organization, nor are we in the business of promoting any political unrest. Our only mandate is to promote the welfare of doctors within Uganda and ensure the delivery of quality health care services to our fellow citizens whom we swore to serve.
John Baptista Humza, Church of Uganda, Family TV News at 8.